Hey, it's Dr. Armerding here, Chief of Staff at KVH. Just wanted to give you guys another update on antibody testing. There have been a lot of questions and requests. When are we going to have this available? And can I get it done? Currently, we do have antibody testing capability. It is a send-out test. So what it requires is a doctor's order. You have to have an order for the lab. And you have to go to our lab where they will do a blood draw, and then we send it out through our lab service LabCorp. And then my understanding is that we'll have the results within 3 to 5, maybe even up to 7 days. So antibody testing is helpful in that it helps us determine if someone has had a past infection. So specifically for COVID-19, the antibody tests that have been developed are supposed to detect antibodies that are created by the body only towards coronavirus or SARS-CoV-2 that causes COVID-19. There has been some debate on whether or not there is cross-reactivity with other coronaviruses that cause the common cold. But my understanding is that, for instance, the antibody test that we have through LabCorp and UW's test is very specific to COVID-19. So this test tells us that at some point you had this illness and your immune system formed antibodies to the virus. So with other illnesses, such as mono or influenza, if we had an antibody test, sometimes we can't tell, was this a recent, the recent illness that you had, or was this a year ago? With COVID-19, because this is a new virus, we're in an interesting time in that if you do have positive antibodies and you had a recent illness, then there's a very high likelihood that that was actually you dealing with COVID-19. Now, a couple things about antibodies, especially with this illness. We're seeing that people don't tend to form antibodies until they've had symptoms for at least 10 to 12 days. On average, I think the average is 12 days. So it's not really recommended to use this test for diagnosis. If you have only had symptoms for a few days, it's not going to be useful because it's actually probably likely to be negative. Whereas in a couple of weeks, it may be positive because you formed antibodies. There are different types of antibodies, IgA, IgM, IgG, IgE. So the one antibody that we're testing for with LabCorp's test is the IgG antibody. This is one that typically has to do with more long-term immunity, whereas the IgM is more short-term. It tends to show up sooner than IgG, but then it goes away after a while, whereas the IgG is a longer lasting antibody and is a good marker for immunity. One of the big questions we've had is, if you do have antibodies, does that mean that you're then immune to COVID-19, immune to reinfection? And there were some small studies in China that suggested that some folks may be reinfected. When I've looked at the data and actually I've listened to a couple talks by epidemiologists and other physicians that have reviewed that data, and in reality it's a very, very small, almost negligible subset of patients that were symptomatic, then their symptoms lessened or went away, and they had a negative test, and then the symptoms came back within a short period, a few days, and then they had a positive test. This could be explained by a false negative PCR. This could be explained by the fact that this illness can sometimes be going from active to more latent, that your immune system's doing well, and maybe it's not doing as well because you don't get good sleep or nutrition, and then the virus fights back and you're more symptomatic. There are people that have had a more long drawn out illness for several weeks. And so that could be an explanation for that. In general, just using principles of epidemiology and infectious disease that have been around for a long time, if you have had symptoms, they've gone away, and now you have an antibody, in general, that means your immune system mounted a response and overcame this thing. So my personal opinion, and the opinion of a lot of physicians that I've read and heard, think that if you do have a positive antibody to this, that you probably are immune. We just can't say that for sure, because there is enough of a question that our immunity to this may not, one, be long-lasting, or two, be completely sufficient to protect us from future infection. So this test really, at this point, we can't use this test to clear people to go back to work and say, you don't need to wear a mask, you don't need to observe social distancing measures because you have the antibody. We still recommend that you observe those guidelines. But I think if I were to have had the illness and then do the antibody test and show that I have a positive antibody, what encouragement I'd have from that is that my immune system put up a good fight, and now I have some antibodies to that virus.